Hello, dear viewers. Today we will discuss 5 medical tests that older adults over 70 should consider with great caution. These procedures can be not only useless, but also potentially dangerous. There is important information that many elderly people do not receive from their doctors. Every year, millions of individuals over the age of 65 undergo medical exams, believing that this is necessary for maintaining their health. However, recent studies show that up to 37% of these tests can lead to unnecessary treatments and serious complications. Moreover, 99% of people over 70 are unaware of the risks associated with excessive diagnostics. One of the most common screenings accounts for 5% of all cancer cases in the U.S., which is comparable to the risks associated with regular alcohol consumption. These facts are rarely discussed in medical facilities or advertising materials, but they are based on scientific evidence. In this video, we will discuss 5 medical tests to avoid after the age of 70 and the dangers they may pose. Before we begin, please leave a comment about where you're from, how old you are, and whether you've had negative experiences with tests or procedures. Do you think elderly people are subjected to too many screenings? Don't forget to like this video and subscribe to our channel to stay updated on new releases. Now, let's talk about the first test that may seem harmless, but can actually negatively impact your quality of life. Number 1. Bone density scanning, DEXA scan. What is it? A DEXA scan is an X-ray test that measures bone density and helps detect osteoporosis. This test is especially common among older women who have an increased risk of fractures. Why should you avoid it? While a DEXA scan may seem safe, it often leads to unnecessary prescriptions. The issue: scan results frequently show reduced bone density in older adults, leading to prescriptions for bisphosphonates. These medications can cause serious side effects. Osteonecrosis of the jaw, a rare but terrifying condition where the jawbone begins to die. Digestive issues, including irritation of the esophagus and stomach, which can lead to erosions and ulcers. Research: a study published in the Journal of Bone and Mineral Research found that treating mild bone loss in older adults has minimal impact on actual fracture risk. For instance, only 0.3% of women taking bisphosphonates reduced their fracture risk over 5 years. Recommendations: instead, focus on lifestyle changes. Physical activity, weight-bearing exercises, and balance training can reduce fracture risk by more than 20%. Proper nutrition. Include calcium-rich foods and vitamins D and K in your diet, such as dairy products, leafy greens, fish, and nuts. Number 2. MRI of the brain for memory loss. What is it? Magnetic resonance imaging, MRI, is used to visualize brain structure and can help identify neurological diseases like dementia and Alzheimer's disease. Why should you avoid it? MRIs often reveal age-related changes that do not necessarily indicate illness. The issue: most findings on MRIs in older adults are normal age-related changes. For example, white matter lesions may indicate aging, but not necessarily disease. Research: in a study published in Neurology, 86% of patients over 70 showed abnormalities, but only 3% had treatable conditions. This creates unnecessary stress and can lead to incorrect treatment decisions. Better approach: instead of an MRI, cognitive tests can be used, such as memory tests, remembering a list of words and recalling them after a few minutes. Attention tasks, simple arithmetic problems and puzzles that help evaluate cognitive functions. Number 3. Cardiac stress test. What is it? A cardiac stress test is designed to assess heart function during physical activity or using medications that mimic physical exertion. Why should you avoid it? In older adults, the false positive rate can reach 40%. The issue: stress tests can lead to unnecessary follow-up procedures, such as angiography, which can cause serious complications, including bleeding after invasive procedures like stent placement, kidney damage due to contrast, dyes used in angiography. Research: in JAMA Cardiology, It was found that more than half of the stents placed after stress tests were done on patients without real symptoms. This means many patients are exposed to unnecessary risks. Alternatives: consider resting EKG or coronary calcium scoring. Resting EKG allows for assessment of heart function at rest, minimizing risks. Coronary calcium scoring identifies calcium presence in coronary arteries and helps assess cardiovascular disease risk. Number 4. Colonoscopy. What is it? A colonoscopy is a procedure where a long camera is used to examine the colon for polyps and cancer. Why should you avoid it? While colonoscopy can be beneficial, the risks increase with age. Risks: preparation for a colonoscopy can lead to dehydration and serious complications such as bowel perforation. In 2019, a study in JAMA Internal Medicine showed that for every 1,000 colonoscopies, only 2 lives are saved, while more than 20 people experience serious complications. Research: the risk of complications in older adults is significantly higher. One study indicated that the risk of bowel perforation increases with age and can reach 0.5% in patients over 75. Alternatives: for individuals over 75, consider non-invasive stool tests, such as the FIT test. This test does not require complex preparation, can detect cancer at an early stage without subjecting the patient to unnecessary risks. Number 5. Full-body CT scan. What is it? A full-body CT scan is used for the early detection of various diseases, including cancer, and is often offered as part of preventive medical checkups. Why should you avoid it? These scans expose patients to high doses of radiation. Risks: each full-body CT scan is equivalent to 500 chest X-rays. Studies show that full-body CT scans may account for up to 5% of cancer cases. Research: in 2023, a study published in JAMA Internal Medicine found that full-body CT scans do not save lives in asymptomatic patients. Thus, the risks outweigh the potential benefits. Better approach: instead of full-body CT scans, use targeted imaging when symptoms are present, such as unexplained weight loss, persistent cough, or noticeable health changes. This is a safer and more effective way to detect diseases. Conclusion: so, dear viewers, we've discussed 5 medical tests that may do more harm than good, especially for older adults. It's important to remember that medical procedures should be justified and appropriate for your health status. Take a conscious approach to your health. Discuss all possible risks and alternatives with your doctor. A healthy lifestyle, proper nutrition, and regular checkups are what truly matter. If you have experiences with these procedures or know someone who has, please share your thoughts in the comments. Don't forget to subscribe to our channel and give us a thumbs up if you enjoyed this video. Thank you for watching, and see you next time.